Hi guys, it's the Real Glow here, and I'm back with another video. My last video was all about my experience with postpartum cardiomyopathy, and this video is all about tips and advice that I have for you and frequently asked questions about heart disease, aka postpartum cardiomyopathy. A fun fact about heart disease is that it's the leading cause of death in America, and it's nicknamed the silent killer because it doesn't present any symptoms until it's too late and the damage has been done. The main question that everyone wants to know: what is heart disease? Heart disease, aka cardiovascular disease, are different diseases that involve the heart or blood vessels. Anything that stops the blood flowing normally to your heart is considered heart disease. There are three different types of cardiomyopathy. There's dilated, hypertrophic, and restrictive cardiomyopathy. I have dilated cardiomyopathy, where the heart is enlarged, thickened, and or stiff, which means the heart can't flow the blood in and out smoothly like it's supposed to because it's weak. Basically, what happened is that during my pregnancy, my heart enlarged to support and give me and my baby the nutrients that we needed throughout the pregnancy. And when I had her, my heart didn't go back to normal, it stayed enlarged. Symptoms of cardiomyopathy are breathlessness, swelling in legs, ankles, and feet, fatigue, rapid pounding, fluttering heartbeats, or dizziness, lightheadedness, and fainting. What causes heart disease is the next question that most people would ask. Genetics, gender, lifestyle, aging, and or smoking and drinking. Let me give you the breakdown. Basically, if you are a woman, you are more likely to get heart disease. If you are an African American, you are more likely to get heart disease. So our black queens out there, if you're black and you're female, you got to be on the lookout, hon, because your life could be on the line. Your lifestyle, basically the things that you eat, what you're doing, the things that you're taking into your body, toxic stuff. Aging, if you're getting older, be on the lookout. Heart disease is right around the corner. Smoking and drinking, obviously. I'm not even going to say anything else. Like, obviously, if you're smoking and drinking, you can get everything. The statistics of heart disease are, as I said, in African Americans, heart disease develops earlier and more people die than any other race. More women have died than men from heart disease. 26% women and 19% men. Southeast states have the highest cardiovascular death rate. Those states are Mississippi, Oklahoma, Arkansas, Alabama, Louisiana, Nevada, Kentucky, Michigan, Tennessee, and Missouri. What are the risk factors? Half of the people that have heart disease have at least one of these risks: high blood pressure, high cholesterol, diabetes, they're depressed, or they're obese. In my case, I was severely overweight, so I'm pretty sure that played a hand into heart disease being more easier to jump on me. Behaviors that can put you at risk as well are smoking and drinking excessively, eating trash, and being a slob and not exercising. How to prevent heart disease in the first place: don't stress, eat a good, healthy, balanced diet, don't smoke, don't drink, exercise regularly 30 minutes to 5 days a week. I'm still working on the no stressing part, working on the eating part, working on the exercising part, or maybe not. And I don't smoke or drink, so it's not a problem. And the number one question is, if you are someone with heart disease or you just plain out don't want it, Is heart disease curable or reversible? This is the one question that I have had mixed answers on, and I've came down to it's about 50-50. Most of the research that I have seen or come across is that no, it's not curable, but it's manageable. Obviously, I'm managing mine. And then the other half is that it can be cured if you lead a very clean and healthy lifestyle, which means eating that clean, rabid vegetarian diet and exercising like you're supposed to, not stressing, you're just doing everything right. But let me put a little disclaimer out there, guys. You could be doing everything right and still have heart disease. Sometimes bad things just happen to good people, and that's just the way that I look at it. You could be doing everything right in the book your whole life and still end up with this. You just have to deal with it. It's a sad fact, but it's a fact that the people like myself have to face. You have to enjoy life while you're here and don't let anything bother you or worry you. And I know that's easier said than done, but it can be done. Tips and advice. So one tip that I have pertains to the fluid portion of the whole heart disease. I have a fluid limit of 1,500 milliliters a day. I cannot drink over that. So basically what I do is I cut it into thirds. From 12 a.m. to 12 p.m. for breakfast, I have 500 milliliters of water. I mean, it doesn't have to be just water. It can be juice or anything. And then from 12 p.m. until about 5 or 6 p.m., I have another 500 milliliters. And then from 5 or 6 p.m. to 12 a.m., I have another 500 milliliters. And that over the day adds up to 1,500 milliliters. And yes, there has been times that I went over and beat myself up about it, but there's no reason to beat yourself up about it. If you go over, it's done. Obviously, you can't make the water come back up. I mean, that'd be pretty gross. Just take your time throughout the day. Don't overexert yourself trying to do anything. Everything will still be there. Don't get too tired and tire yourself out where you need to drink a whole lot. Just take it in stride, take slow sips, and you will be completely fine. Another trick is candy, chewing gum, all that stuff helps you to keep away from drinking a lot. Chewing hard candy, sucking hard candy, and my personal favorite is lemon juice. Sucking on half of a lemon is a good way to stay hydrated. Sucking on half of a lemon, it kills the thirst. I think that's what they say. I don't know. But basically, if you suck the juice of a lemon, it does something to the thirst, and the thirst just goes away. And I just got so used to the taste of it that I actually grew to like the way lemons taste. So now I actually eat them. Other tips that I have, if you're looking at going through procedures and stuff, like I remember when I went through my first procedures, getting my heart IV / catheter, or getting the paracentesis where they pull the fluid out your belly, you're gonna be completely fine. I know they tell you all this stuff that can happen during the procedure, but don't focus on that. Focus on how you're gonna feel afterwards, how much better you're gonna feel. I went into those procedures super scared, but I prayed before each one of them and I was completely fine, and you're gonna be completely fine as well. You just need to focus on getting better and to keep going and enjoying life, because there is so much life to enjoy. Having heart disease is not the end of the world. You can still enjoy life You just have to do it a little differently, and it's not all that different than before. It's not. I'm here if you guys ever need to talk. If you're in the same situation I am, please message me and we can chat. I've been where you are. I am where you are. Well, that's the end of this video, guys. Please like, comment, and subscribe. Have a good day. Bye.